Yes, the definition of who's infected keeps changing, and it's not entirely clear how the virus is spreading. But a picture of this outbreak is coming into focus.
The data from China continue to show a decline in new confirmed cases. Once again, we're encouraged by this trend.
The virus could mutate, and the outbreak isn't over yet. But infectious disease experts are beginning to see patterns.
Over the past several weeks, there's been a growing appreciation that this infection can cause a more mild illness in a larger proportion of people.
A new Chinese study backs up that observation. Researchers looked at medical records from 72,000 patients with COVID-19 in China. They found about 80% of cases were considered mild, and just 5% of patients became severely ill.
What we're seeing is that the earlier patients are tested and treated, the better they do.
About 1,000 patients in the Chinese study died. Most of them were over 60. That puts the fatality rate around 2%. Outside of China, estimates put it at less than 0.5%. And according to the data, the epidemic likely peaked around January 23rd to the 26th.
The massive control efforts that have been imposed by China to get this infection under control may be slowing down this freight train.
But it could be picking up steam in other parts of the world.
There's certainly a lot of interconnectivity between China and many places in Africa. There's already been a confirmed case in Egypt.
Public health experts say they need more data sources in order to confirm that the number of cases in China is in fact dropping. But the World Health Organization insists if this outbreak is to be contained, the world must act now. Christine Burak, CBC News, Toronto.